been an 86% of people or of children that had come out of the malaria pandemic because of the vaccinations that were available, and the government doesn't intend to let this ratings come down. There's been cut off donor supports, like the major donors also being scaled back, and then the contributions to Gavi and the Vaccines Alliance could result in a bit of scarce vaccination. But also the minister assured the House that nothing of that sort is going to happen, and that funding for the vaccines will be provided. So I just put in a word for that to also call on government's attention, that they should make provision, or the Minister of Finance should make provision for the Ministry of Health, so that the vaccines that are expected in the country do not come down. Maybe initially, if you were getting about 200 boxes, example, of vaccines, it shouldn't go down to 100 or 50 because of the donor support system that had been cancelled. And then also to draw attention that it is not just Ghana that has been cut off from the donor support system. It's a whole lot of country, the US aid system and all the things that is going on now. So basically, I was just to draw government's attention and the Ministry of Finance's attention to the fact that the Ministry of Health should be more financed, so that our children, and especially children under 5 and our pregnant women, would be happy. They go to the hospitals, they know that they are getting this malaria vaccines, and they know that they are preventing their kids from and getting malaria. Then also the smiles on their faces when they wake up in the morning, because a mother in the rural area would wake up, and then at the age of between 2 and 5 years, the scare, when is my child going to leave me because malaria, yes. But now, because of the introduction of the vaccines, our mothers are happy. They walk their children to school with smiles on their faces, very broad smiles, and the kids to go to school, learn well and play, because they don't suffer from the malaria disease. So this is just a call to action, so that the cutoff of the donor support doesn't affect that's very important exercise of malaria vaccination.
Which means that you accept the minister's assurance that although there's been cut off, the government is committed to making sure that they fund this locally or internally. And your appeal is that it must not drop beyond the limit we are now, and that they must rather upgrade it even in the face of the cut off of funds.
Exactly so.
Thank you.
You're welcome.